Legislator Blankley, can you hear us?
I can hear you. Can you hear me? Can you hear me? Testing, testing.
Give us a second. We're testing the sound. We can't really hear you.
Test, test, test. Hello, testing.
All right, try again.
Test, test, 1, 2, test, 1, 2. Test, test, test. Testing.
I can hear him very, very faintly.
This better? Is this a better microphone? Test.
Try one more time.
Test, test, 1, 2. Test, 1, 2. Test, test, test.
I don't think it's an issue on your end. I think it's an issue on ours.
Okay.
We can hear him very faintly. I don't know if it'll get better than that.
Ready? Yep, just turn it on. The November 26th, 2024 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley.
Here.
Mr. Blankley is present. Miss Bonnick is excused. Mr. Brew. Mr. Brew is present. Mr. Cruz. Mr. Cruz is present. Mr. Dondorfer. Mr. Dondorfer is present. Chairwoman Hasman.
Here.
Chairwoman Hasman is present. Mr. Milne. Mr. Milne is present. Ms. Smith. Ms. Smith is present. Ms. Vasquez Simmons. Ms. Vasquez Simmons is present.
Is there anyone signed up for the public forum?
No, there is not.
Is there anyone present who has not signed up to speak who would like to address the committee at this time? Seeing none, I would now like to introduce Robert Franklin, Chief Financial Officer of Monroe County, who is here to present the 2025 proposed Monroe County budget as it pertains to the Human Services Committee. We will have a question and answer period following the presentation.
All right, good afternoon, ladies and gentlemen. Thank you for your time. This won't be too long. It'll be a little longer than last night's, but not so bad. We'll get started. Okay, our tonight's budget presentation for our 2025 proposed budget as it pertains to the Health and Human Services Committee. As a segment of the budget, spending for Health and Human Services accounts for about 57% of Monroe County's overall budget. It's about $865.9 million. Appropriations for this segment of the budget are growing by about $71.4 million. It's about a 9% increase. In the context of the overall spending growth in the proposed budget, this $71.4 million represents more than 97% of the total $73.6 million budgeted increase. I need to point out, however, that $25 million of this growth is related to the anti-poverty grant. It's a very big chunk of this $70 million growth. So this time next year, when we're talking about the 26 proposed budget, if that grant is not renewed, this budget's going to be a little lower. Okay, so where can this $71 million of growth be found? The growth really is in Department of Human Services and Public Health. The proposed budget for DHS is increasing by about $57.4 million, again, almost half of which is related to that $25 million state anti-poverty grant. Appropriations for public health are increasing by $12.9 million, and that is almost entirely related to the early intervention and preschool special ed programs. In dollars, budgetary growth at MCH, our community hospital, and the Veterans Services Agency is nominal, but for veterans, that $300,000 is a little more than 18% higher compared to the adopted budget this year, and I find that pretty remarkable. And while I don't normally spend a lot of time talking about my prior work, this is very remarkable. The average Veteran Service Agency adopted budget from 2013 through 2016 was only $522,000. The average budget from 2017 through 2020 grew to $790,000. Their last 4 budgets, including this proposed budget, averages $1.6 million. So compared to when I started this job, the Veteran Service Agency's budget has more than tripled, and I just think that says a lot about both this administration and this body. Looking specifically at our Department of Human Services, appropriations for the Social Services Division are increasing by about $50.1 million. Part of that growth, again, is the $25 million state anti-poverty grant that I mentioned a moment ago, and also a $1.1 million state-funded eviction forestallment grant. Most of the anti-poverty grant will support agency contracts, while the eviction forestallment grant will be spent as public assistance benefits. And speaking of public assistance benefits, comparing the proposed budget for '25 to this year's adopted budget, there's about an $18.4 million increase in daycare subsidies, a $2.7 million increase in foster care and special ed maintenance benefits, and about a $1.6 million increase in preventive services. Conversely, there's also a $6 million reduction in TANF benefits and a $400,000 reduction in safety net benefits, both due to caseloads that have not grown as previously expected. The budget book, as you know, references the amended budget rather than the adopted budget, so I just wanted to highlight those changes for you. Also of note, it's a $6.7 million increase in our required Medicaid cap payment to the state, and a $1.5 million increase in debt service, and that's related to construction of the new detention center out in Rush. Department of Human Services payroll and benefits are virtually unchanged, even with new staff, pay raises, and step increases because of last year's, the current '24 budget, non-recurring employee retention bonuses of $3.3 million, and going into next year, the application of a 9% position vacancy factor. We did not do that last year. Mental health is the other division with significant appropriation increases, about $5.9 million. Most of that increase relates to additional state pass-through funding, but the Office of Mental Health is also spending $1.95 million of their specific opioid settlement funding that New York State received and passed through to the county. I can look forward to our Department of Public Health. While it's a much smaller department than Human Services, it doesn't make it any easier to summarize everything that's changing within their budget. So just big picture, within public health, appropriations are increasing by about $12.9 million. It's about 15.5%, overwhelmingly due to a $7.9 million increase in early intervention and preschool special ed transportation costs. Also, a $2.6 million increase in tuition and itinerant teacher costs. I'll mention that these contracts, both transportation and for itinerant teachers, run July through June. They're not calendar year. So no, the health department really does not always have a whole year to plan for cost increases. And I say that because of the recent budget reappropriation referral that was somewhat of a big pill for some members to swallow. The county got burned when the transportation provider told us in the 11th hour they wouldn't renew their contract unless they got a bigger increase than what was previously negotiated. We didn't have time to bid that service out, so the Department of Public Health felt they had to agree to their terms. I will also note this past summer, New York State provided retro rate increases for contractors going all the way back to 2016. The state has provided retro rate increases before, but they generally only go back a year or two. They have never gone back 8 years, to my knowledge, up until now. Also increasing next year in the Department of Public Health, payroll and benefits. Payroll and benefits are up by about $959,000, even after backing out $698,000 of non-recurring retention bonuses and after applying a 5% position vacancy factor. Moving forward, looking at Monroe Community Hospital, as in prior years on this slide, I tend to focus on how MCH funds its operating budget rather than what they spend their money on. Patient revenues, and that's patient revenues from all sources, Medicaid, Medicare, private insurance, represents an estimate based on the projected average daily census of residents, our payer mix, and payment rates. For 2025, the budget is based on an average daily census of 410 residents. That's slightly lower than the budgeted estimate for this year, but it's still higher than the 400 resident count we've recently achieved. Their budget also reflects a 4.1% increase in annual revenue per resident, reflective of rate increases. I appreciate the county executive's support and your support for a tax subsidy for Monroe Community Hospital. I look back to 2007, and in those 17 years, patient revenue has exceeded budget a total of only 3 times, for a total of $2.2 million. Conversely, patient revenue has fallen short of budget 14 times, for a total of $79.2 million. So this tax subsidy that you've been supporting the past years is what allows us to, at least going forward, more reasonably budget patient revenue. From a credit rating perspective, you may or may not have read the recent reports from Moody's and Fitch. Community hospital operations is front and center, at least with Moody's. They don't really like to see tax subsidies for an enterprise fund, but they prefer that over continuing to pretend that everything is fine, something we've done in the past. The other big revenue challenge is our Medicaid upper payment limit. You've heard me very tongue-in-cheek comment that this is the greatest government-sponsored money laundering program. Monroe County sends New York State $1. New York State reports that to the Fed. The federal government sends New York State $1, and Monroe Community Hospital gets back $2. This upper payment limit, Medicaid upper payment limit program, is subject to an annual negotiation between the state of New York and the federal government. And even when agreement has been reached, it's still basically a crapshoot. The agreement for state fiscal year 23-24, they run April of 23 to March of 24, was just announced. So even with that agreement, New York State has only so far released 2 quarters worth of Monroe County's share. Last but not least, if we can turn to our Veteran Service Agency, appropriations, as I've mentioned, are increasing by about $288,000, of which payroll and benefits make up most of that, about $217,000 of that growth. The big story in this budget, I think, is what you've already heard about, and that's the expansion of our nature-based therapy program. The VSA, you may recall, has insourced that program earlier this year, and with next year's expansion, we'll be able to double the number of therapy cohorts from 2 this year to a minimum of 4 next year. So, Madam Chair, that concludes my presentation. Happy to field questions.
Thank you, Mr. Franklin. We can move on to a Q&A now. Do we have any questions? Legislator Cruz?
Just one thing that piqued my interest, excuse me. Yeah, Chair, something was mentioned about the contract from the Transportation Department that was not followed through at the 11th hour. More about that and how they were able to last minute, or why they changed. What was it that we previously agreed upon? And then the amount of money, the differentials in amount of money, or what was agreed upon versus what we ended up paying.
Yes, and I have people from the public health here who may want to tag team. I'll give the short and dirty answer, well, dirty answer. I don't want to air too much dirty laundry, Madam Chair. I will say, that's right, late-breaking news, and it happened twice. Our transportation provider refused to renew their contract when they had another year remaining, because they were acquiring a new fleet of buses. And their financer, likely a bank, wasn't excited about only 1 year left on their county contract. So we agreed to renew that contract for another 3 years because they were a decent provider. At that time, this is going back a couple years, we were paying $16 million for transportation. Today, Madam Chair, we're paying $24 million for transportation.
What was the previous number through the chair?
$16 million, and that's a couple years ago.
The chair, this is all taxpayers' money?
Madam Chair, the majority is, I believe, state funding, and the slight minority of funding is county funding. It's a 59 split.
Through the chair, just to clarify then, I mean, I wouldn't necessarily label this as dirty laundry just because, you know, I have a right to know what's going on, right? So, I mean, I thank you for your answers. What is the name of our transportation agency?
Today, Madam Chair, is Ontario Bus.
Thank you.
Going forward, Madam Chair, the proposal is to put this out for public bid early next year, as opposed to an RFP process.
Last question through the chair. So there isn't, I'm assuming, nothing that legally binds this company to stick to their agreed terms?
Madam Chair, renewal of a contract is upon mutual agreement. The contractor, for the most part, any contractor, well, I got a lawyer who may tell me I'm wrong, but for the most part of our contracts are renewal by mutual agreement. So if you don't mutually agree, the contract doesn't get renewed.
I'll say, so through the chair, whatever was agreed upon previously wasn't then on?
Yeah, it's not final until it's signed. You know, I will say, Madam Chair, a lot of contracts in the county have renewal terms that increase, say by, you know, the greater of CPI or 5%, something like that.
Through the chair, thank you very much for your answers. It's just for learning purposes, right? And I hope that we could work on something so in the future we're not being caught off guard.
Thank you.
I finished my time.
I have a couple questions, if you don't mind. On page 184, there was a decrease in the net county support, and I was wondering if you could tell us how much money are we mandated to have in the safety net? It's okay if you don't have that off the top of your head.
Oh, I'm sorry, Madam Chair, I was on the wrong page.
Oh, that's
Page
okay.
184, our Safety Net Assistance Program.
Yes.
And the question is the decrease in net county share.
Yeah, and what are we mandated to have in the safety net?
Madam Chair, it's quite complex, but I will try to work through this page succinctly. We always start with a projection, a reasonable estimate of where we see caseload trends heading, and the individual cost of the various components of a case. It could be the shelter portion of a grant. It could be unit heat, fuel. So we always look at a projection of the caseload and the cost per case, and that gets us a budgeted appropriation, as you see in this book, $38.2 million and change. And then we look at the revenue streams that can support the Safety Net Assistance Program. Small amount of federal aid. State aid, I think most people know, state aid reimburses about 29% of Safety Net Assistance cost. Also on this page is emergency assistance for singles. It's kind of blended together. but state aid overall is about 21% reimbursement. We also get a variety of repayments of assistance. There's a couple ways this happens. One is through closing a case, a fair hearing is called. We find out there's earned income that was not previously reported. An administrative law judge rules an overpayment in our favor. There is a Treasury offset program. Believe it or not, some people really do win the lottery. The state knows about that because it's their lottery, and they tell us, and they intercept the proceeds. There are also repayments because there are a number of non-custodial parents on assistance who owe child support, and we work with the child support unit to co-manage and co-monitor those cases. So that, in a very succinct nutshell, is where we come to a bottom line for net county share.
And on page 146, the Prison Rape Elimination Act, we have auditors that are working on an action plan. Can we receive a copy of that action plan when it's completed?
Madam Chair, that should not be an issue whatsoever, no problem.
And then on page 166, there's the CDC expansion. And I was just wondering, do we currently have the staff to accommodate this? Or we need to hire out for that?
Madam Chair, if you're asking if we currently have the staff today, the
Yes.
answer is no.
Okay.
We foresee the facility to be up and running by the fourth quarter of 2025. This proposed budget increases headcount significantly for the detention center. So that staffing model matches the requirements put down to us by the state.
Further questions? Yes, Legislator Milne? Oh, go ahead, Legislator Milne.
Thank you very much. First of all, Mr. Franklin, thank you very much for this presentation. I often think that if time permitted and we were able to have these presentations before a time when we're asking questions, things might go a little bit quicker. And that's not your fault, that's just the process. But again, thank you for a nice presentation. With that, I do have a number of questions that I will go through, and hopefully my page numbers, et cetera, will be correct. So through the chair, a couple of general questions. Through the chair, what are the percentages of mandated versus unmandated costs for the Department of Human Services?
Madam Chair, we'll follow up on that.
Okay. And through the chair, how much, if any, general fund balance is being applied to Human Services budget? And if general fund balance is being applied, what is the breakdown of restricted versus unrestricted applied fund balance?
Madam Chair, if the members look at page 167, page 167 outlines, I'm sorry, Madam Chair, is the question specifically for Department of Human Services or the entire segment of Health and Human Services?
The Health and Human Services budget.
Well, that would combine quite a number of entities. I guess
Just
I will-
Human Services, I'm sorry. Just
Well,
Human,
Madam Chair, page 167 outlines the budget for Department of Human Services, $670 million and change of appropriations. All those appropriations, except for debt service, are accounted for in the general fund. Debt service is a debt service fund budget item. And there is no appropriated fund balance reported in the bottom of this page in the revenue section. So there is no differentiation of any kind of fund balance.
thank you. You were mentioning the, prior through the chair, we were talking about the Youth Detention Center's 2024, the Youth Detention Center. Through the chair, in the Youth Detention Center's 2024 objectives, it listed continuing to collaborate on Phase 2 construction planning and ensuring all safety measures are in place, but this is not listed in the 2024 major accomplishments. Can we get an update on that?
Well, Madam Chair, I don't believe anyone from Environmental Services here, who is actually leading the construction project, is here to respond, but construction is underway. It started last year, and as I mentioned a few moments ago, we anticipate the center to be up and running and open by the fourth quarter of '25.
I'm assuming Environmental Services can follow up if they have any add-ons to that.
Ma'am.
Thank you. Moving to page 172, through the chair, thankfully, the number of estimated reports of physical abuse in 2024 in the 2025 proposed budget are about half of the estimate in the 2024 proposed budget. Is there a specific reason you think that this may be, or is this just a variance, is this variance just random?
Madam Chair, our Child and Family Services Management team is here. Please just give us a moment.
Repeat the question?
Yeah, so the number of estimated reports of physical abuse in 2024 in the 2025 proposed budget are about half of the estimate in the 2024 proposed budget. Is there a specific reason for this, or do you think this variance is just random?
Through the chair, the estimates are based on an average number of reports in each category the year prior to the budget, and it is largely a best guess based on patterns. The difference in numbers would just be mathematical chance, quite honestly.
And then probably along those same lines, why, through the chair, why are the number of services to prevent foster care so far below projections in 2024?
Through the chair, the contracted preventive services have had fewer, for lack of better wording, slots, largely because they have been down staff. And so the difference in numbers is related to the staffing in the programs.
Okay, thank you very much. Through the chair, on moving to page 176, why is the average monthly family assistance caseload so much lower than projected in 2024?
Madam Chair, our management team from the financial assistance side of the house is also here. If you could just give me a moment.
And Chair, if I may, while they're coming out, you know, there's a lot of different departments involved in this whole group. Is it possible to have them out here so we can,
If there's room, certainly.
I just want them to, I don't want to hold them up either. you
Yeah,
know, as
no,
we
I
skip around.
understand. I have no problem with that if they can squeeze in. May need you to repeat the question.
And that question was, through the chair, why is the average monthly family assistance caseload so much lower than projected in 2024?
Good evening, everybody. Denise Reed from Monroe County DHS. Through the chair, much like what Amy just described, projections are just that, projections. We try to look at trends, application data, acceptance rates when we're making decisions around caseload projections. And unfortunately, over the past couple of years, or fortunately, I guess, depending on how you look at it, we don't quite meet what we're expecting. If you've been around for a few years, you know that during COVID, we had a significant reduction. And each year since COVID, we've been anticipating that the caseload will increase, and it simply has not to the levels that we think. I mean, it is increasing, but not to the levels that we have been projecting. So we didn't have that caseload increase this year. We are, again, expecting an increase next year, but we will see what happens as we look at the trends through the year of applications and denial rates and acceptance rates. As minimum wage goes up, fewer people are eligible for public assistance. Things like that are all factored into what happens with caseload data.
Madam Chair, if I can just tag team onto that, if I may briefly. This body has heard me comment before. Our public assistance benefits are entitlements in the state of New York. We cannot say no. And we always, at least for the past 10, 12 years, have really tried to err on the side of caution. And when the team is projecting their caseloads into the future, always try to err on the high side. Failure of the legislature to appropriate sufficient funding to support these caseloads is not a reason for us to say no. And that is something I personally have experienced when I used to work at the agency, and something this county does not want to try to duplicate again.
Thank you. Staying on page 176, through the chair, why were there so many fewer fair hearing issues decided in 2024 than were projected?
Through the chair again, since COVID, and I know that seems like a long time, but not in state years, the state had suspended operations at their Office of Administrative Hearings. So while clients in Monroe and across the state continued to call fair hearings, the state was not hearing them. And so there was a significant backlog. And each year since COVID, we have anticipated that the state would catch up, and they have continued not to do so. We did recently, this quarter, start working with them on trying to dispose of some old ones, so we may see an increase in that towards this fourth quarter of 2024 and the beginning of next year, but it simply is just because the state has not caught up with the backlog that they created when they suspended hearings in 2020, 21, and 22. Through the chair.
Thank you. And then through the chair, on moving to page 178, why did we project so many more intentional program violations that actually occurred, and why are you projecting a similar number in 2025?
So through the chair, again, related to COVID, intentional program violations are referrals that we make when we believe that a client has indeed committed an intentional program violation, but these are heard as well by the Office of Administrative Hearings. And so we have referrals that are out there for what we call IPVs, or intentional program violations. And each year since COVID, we have anticipated that the state would catch up on hearing those cases and deciding whether or not the agency is affirmed on those IPVs. And as you can see, they have not met our expectations. Again, this last quarter of 2024, they have been working on several cleanup projects, and so we do anticipate seeing an increase in that, and hopefully the projections that we have for next year will come to fruition. Through the chair.
Thank you, ma'am. And through the chair, on page 181, why is there now a new statistic for specialized secure detention days, and why are the numbers projected to be so much higher than in the 2024 proposed budget?
Madam Chair, that is a new performance measurement, as I'm reminded, because I asked for it to be included. Raise the Age was adopted in this state several years ago, and we are now required to differentiate between secure detention and specialized secure detention. And if we're going to run a $62 million facility, we ought to be reporting on the care days provided.
Thank you. Through the chair, moving on to page 195. Why is the older adult services information system projection so much higher in 2025?
Do we have a rep from our Office for the Aging who will be right here?
Through the chair, could you please repeat the question?
Sure. It appears that the older adult services information system projection is much higher in 2025. Why would that be, through the chair?
Could you reference where that indicates that, through the chair?
Yep, it's page 195. And older adult services and information system, OASIS. I think the number was like 900 the previous year. Is that?
Through the chair, is that specific to OASIS?
Yes.
Okay, through the chair, the primary reason is OASIS suffered severe attendance problems during COVID. Many of their classes were held online, and now they're bringing the classes in-house, and the attendance has been increasing.
Okay, thank you. And these next two questions may be very along those same lines, but still on page 195 through the chair, why was the number of congregate meals so much lower in 2024 than projected?
Again, it was a chilling effect from COVID. We're seeing folks now venture out and attend the congregate meals. Some folks that were going to centers for congregate meals received home delivered meals. There was a fear factor for older adults venturing out in social situations. Through the chair.
Thank you. And then I would guess then that through the chair, why was the number of Win home delivered meals so much higher than projected? And again, I would think that that would go back to the same answer, COVID.
Through the chair, correct.
Thank you, sir. Moving to page 197, this is regarding youth served. Through the chair on page 197, why were there over 6,000 fewer youth served in 2024 than projected?
I'm sorry, through the chair, can you repeat the question?
Yes, on page 197, it shows that there were, over 6,000 fewer youth served in 2024 than projected.
Through the chair, due to enrollment in some of the programs or cost to the various vendors that we use, numbers changed.
And then we may be moving to yet another, I apologize. Through the chair on page 200, why were there more than 3,000 fewer alcohol and substance abuse individuals served than were projected?
Through the chair, that is a question that is unknown. We are struggling in that area, and we're seeing that across outpatient and residential services where the enrollment is down. Some are saying that is due to staffing, and some are saying that is due to Medicaid rates and commercial insurance issues. and some are saying that New York State Office of OASIS, actually, they said that harm reduction is in place, and people are able to take medication without participating in groups and individual sessions. So those are some of the factors that we are hearing from community providers statewide.
Thank you.
You're welcome.
Some appropriation questions. Moving to page 502, Human Services Central Administration. Why were professional services eliminated from $800,000 in last year's budget?
Madam Chair, the 24 budget included, the 24 budget originally started out $800,000 higher with the inclusion of United Way for the Community Integration Initiative. That work has since concluded and is no longer required in this budget.
Thank you. Keeping on the same page for the next couple of questions through the chair. What is the new and this is a very small number in a big budget like this, but what is the new $4,500 in computer equipment? Is that just new equipment that needs to be purchased for the department?
Correct, the laptop and monitors, Madam Chair.
And again, on the same page, why did retirement go up by $82,000? And are there any other drivers of the $109,000 change in total benefits?
Madam Chair, the changes in employee benefits are largely related to changes in payroll. Payroll and central administration is a little higher than the 24 amended budget, and therefore would expect to see increases in pension and FICA commensurate with that increase. Our cost for medical, both active and retiree, is reflective of the number of employees we're anticipating in this budget to select a medical plan, and the number of retirees who have left the Central Administration Division over the years.
Thank you. Moving to page 503, continuing Human Services Central Administration, why did information services raise by about $116,000?
Particular line, Madam Chair, is in cost allocation spread of the, I'll call them, if you don't mind, the generic services within information services as opposed to specific licenses costs for very specific systems. Information services as an internal service fund, those costs are allocated to all user departments in the county, including the Department of Human Services. So those costs, Madam Chair, are all formulaic and driven by our cost allocation plan.
Thank you. Through the chair, moving to page 504, Human Services, Child and Family Services still. Why did salaries drop by about $110,000?
Most of that, Madam Chair, is reflective. Of course, there are pay and step increases as contractually required, but most of this decline is reflective of application of a 9% position vacancy factor.
And along the same lines, through the chair, still on 504, why did temporary help go up by $30,000?
Madam Chair, the department is, especially in the Child and Family Services Division, utilizing over the past couple years an increasing number of per diem workers, which are much easier to recruit sometimes in a tight labor market.
And again, the next few questions are still on 504. Why did standby call-in pay go up by $120,000 and overtime up by $80,000?
Madam Chair, those are reflective of the department's best estimates of next year's utilization relative to what they've seen in actual utilization over the past several years.
Thank you. And through the chair, again, remaining on 504, why are commercial services raising by $300,000?
Well, something new there, Madam Chair. Most of this line includes our contract for scanning, imaging, and indexing records. It's about $300,000. But this line also includes quite a bit, $120,000 worth of translation services, interpreting services, and the printing of a variety of child protective services, pamphlets, and posters. So the increase really is reflective mostly of scanning, which did not occur in the current budget year.
Thank you. Through the chair, I see that the line for maintenance buildings is decreasing by about 50,000. Is that simply because projects have been completed and not as much work needs to be done?
No, Madam Chair, that's because I moved money to the building account over the past couple of years. Well, historically, funding has been tight for our building services account, so departments have budgeted for maintenance and repairs on their own. But the real answer is to put the funding back in the building account. So that is specifically what happened here.
Great. And through the chair, still on the same page, 504, why is the professional services line item decreasing by 1.1 million?
Well, Madam Chair, the 24 amended budget does include about $484,000 of professional service contract that has been moved elsewhere in this budget, specifically the page for purchase of services, and especially if it's a mandated preventive service. But I will also note the 24 amended budget included, $300,000 for respite services, which were not actually RFP'd this year, and $150,000 in capacity building, which also was not RFP'd this year.
Thank you. Through the chair, moving to page 506, still under Human Services, Financial Assistance, and maybe some of the same answers from another department, but why have salaries increased by over 938,000? And why has overtime gone up by 227,000?
Madam Chair, the Financial Assistance Division has seen in this proposed budget an increase in staffing, about 25.5 FTEs worth. And of course, this line does account for contractually required pay and step increases. But again, as I've noted before, we have also applied a 9% position vacancy factor. I should probably note that the line for temporary help is a little reduced. It's because part-time staff, I'll call them longer-term part-time staff, are now budgeted under salaries as opposed to temporary help. And the overtime increase is reflective of the utilization we've seen this year and in 2023, but maybe not to the extent we've seen in 2023 because we've added 25.5 FTEs.
Thank you. Through the chair, remaining on page 506, why have the commercial services gone up by 138,000?
Most of this, Madam Chair, is related to our contracts for interpreting services, document translation, which has been quite a focus for the past couple of years. We also have a contract for temporary workers, kind of like, I don't know who the contractor is, but like Kelly Temp Services, and our contracts for document destruction. So we have seen over the past couple of years an increase in utilization and costs, and this proposed budget is trying to capture that prior historical.
Thank you. Through the chair, again, remaining on 506 for the next couple of questions. Why the increase of $456,113 in rental space when we didn't budget at all for it in last year, but then we ended up spending $374,000 in amended? What is being rented and why now are we budgeting for it?
That was our, Madam Chair, an evolving project. This is Troop Street, the new county-owned shelter. So quite an evolving way this has been envisioned to be paid for. Started out as agency contracts, moved over to our per diem that we pay shelters. Originally, we contemplated that our provider would sublease Troop Street building from us. That did not happen, so now we have to account for the rent ourselves.
And remaining on the same, through the chair, why has the public assistance benefits line gone up over at 1.3 million?
As in every year, this budget line includes our funding for Code Blue, and HEAP. But I did mention in my presentation, Madam Chair, shelters arrears eviction forestallment grant. That's about a little over $1 million, and that is new going forward.
And on the same page, what is the extra $100,000 in other expense?
That particular line reflects the charges New York State sends us. We have to pay the state for all the client notification system, all the mail that we send out. We also, believe it or not, pay them for fair hearings. Benefit cards, so there's a variety of state charges we have to pay for.
And through the chair, why have agency contracts decreased by about $550,000?
That reflective, Madam Chair, of the evolving nature of how we were planning to fund Troop Street, where the agency contract was our payment to the provider, which originally included dollars for a sublease, but now we're paying the lease ourselves.
Thank you. Madam Chair, through the chair on page 507, why has information services gone down 186,000?
Madam Chair, again, this is reflective of the non-specific information services that are provided to user departments, and it's based on a ratio of requested services, user licenses for a variety of software products, and general changes in the information services overall budget. So this is financial assistance. This budget reflects their proportion of those chargeback costs.
And through the chair, remaining on 507, why has City Place gone up 224,000?
That increase, Madam Chair, is specifically related to this legislature authorizing new bonding for the renovation of City Place. You'll see that on page 412 of the budget book. We're paying over $1 million in 2025 for that bonded debt.
Thank you. Just a couple more questions on my stance. Moving to page 512, Human Services Children's Center. Salaries I see are increasing by 2.2 million on page 512 again. Through the chair, why are those, what are those increases? Just simply.
Madam Chair, as we've mentioned and as you've asked, the new detention center should be up and running in the fourth quarter of 2025, and this reflects the addition of 43 FTEs to help staff that.
And I see that overtime is going up by about 356,000 through the chair. And
Yes, Madam Chair.
And is that strictly caseload? Or a lack of staff?
Madam Chair, no, it is not reflective of a lack of staff. I'm not the department manager, and I'm not sure if the department manager is here. Oh, Ken.
Madam Chair, this is going to be reflective to train our staff in reference to the new building. There are new systems and new operations that our staff need to become acquainted with in order to safely operate the new building, and that's going to require training, which comes from our overtime budget.
Thank you. Remaining on page 512, why are commercial services going up by 324,000?
That's going, Madam Chair, that's going to be reflective of the services that are going to need to be provided and that can't be provided by our staff.
Thank you. My last question on page 512, why is rental of space being eliminated for a $121,000 reduction, and what space is no longer being rented?
Our trailer, Madam Chair, our trailers will no longer be needed when the new build is completed.
I yield the floor.
Yep, Legislator Cruz? Second? Second, we have 5-minute recess. All in favor, say aye. Aye. We are recessed for 5 minutes.
I'm going to be number 26, but I
Is it not connected? All right, Legislative Vasquez Simmons, did you have some questions that I passed you up last time?
Ma'am, I believe the question is, why is other contractual services increasing? Madam Chair, there is an increase due to 2 new contracts. The Office of Agency will have a contract with Hub Ed Elite and Daniel June Senior Computer Training. So this is a specific training contract. So it's really those 2 new services that are driving the change. So, Madam Chair, I think that's the question I just answered. So I guess the question was on the next line, agency contracts originally, the 9.5 to 10 million? That's correct. Madam Chair, predominantly this is the result of additional allocations from the state of New York, which is predominantly pass-through funding. Madam Chair, none of the construction costs are included in the operating budget. We do have a separate capital fund to manage that. So these are the operating costs reflective of existing services for both secure and specialized, and the additional operating costs once a new facility comes online.
Chair, on page 179, support increased by 30,000. Why the increase? I'm sorry, contractual services increased by $135,000. Why the increase, and what contracts were changed?
Madam Chair, this particular line increase really is related to $150,000 in funding for leadership training. Now, this is staff development houses most of the training costs, so it's not, this is for all staff within the department.
Chair, I'm going to ask a question about safety net, and I apologize if it's redundant. How much money are we mandated to have in the safety net budget?
Was the question, how much are we mandated to have?
Yeah, I think Mr. Franklin answered that earlier.
Okay, do you mind repeating it?
There's no dollar amount we are mandated to have. My commentary about safety net was, it's an entitlement program in New York State. So failure of the legislature to appropriate funding is not a reason for us to say no. We still have to provide the benefits, and then we will have to scramble to find appropriations later. So this appropriations budget is built on our best estimate of caseload and the varying cost of the components of a case.
$530, runaway homeless youth. There was an increase of over 116,000. What about that? What contracts are included?
Through the chair, can you repeat the question, please?
withdraw the question. On page 343, under Veteran Service Agency, there's an expected decrease in benefits. However, there is an increase in budget. Can you talk a little bit about, if the budget's increasing, why the services aren't correlated?
Madam Chair, I will let our Veteran Service, I'll let our Veteran Service chime in, but yes, the budget is increasing significantly, $300,000, and we are expanding the services primarily through the expansion after we insourced our nature-based therapy program.
So the vast majority of the increases are personnel costs. We added 2 new service officers that were mandated under the ARPA Resolution 230 of 2024. We transitioned the Veterans Therapy Liaison position from part-time to full-time. We transitioned the Veterans Counselor position from part-time to full-time and gave that one a group increase to 15, given that that position was going to be managing individual clients independently of the therapy program manager that we have. There was also a group increase for our former senior service officer to principal service officer to be more commensurate with the duties that she was performing. So that, and almost all of the increases are personnel costs related to either expansion of programs or commensurate grades.
Chair, on page 283, environmental health, contractual services decrease by $5 million. Why and what contract services are affected by this?
Good evening. Through the chair, could you repeat the question and page number? So sorry.
Sure, it's page 283. Contractual services decreased. So the question is, why the decrease and what contracts and services are
Oh, through the chair, many of our programs are supported through grants that are appropriated throughout the year, so those numbers will not be reflected in the documentation tonight.
Okay, I yield the floor.
Questions? Yes, Legislator Smith.
Versus family assistance. Why are there now personal services or personnel services and benefits under the family assistance division for a total of 20,000 increase?
Madam Chair, this is reflective of that $25 million anti-poverty grant received from New York State, which does allow a portion of salaries to be charged against it.
Thank you. Through the chair to the administration, what is the additional and new $178,000 in maintenance computer equipment for?
Madam Chair, that's our licensing of Simply Gov. It's a internet-based software product.
Thank you. And through the chair, why are public assistant benefits $6 million less than last year?
Madam Chair, as I mentioned earlier, that is really reflective of the fact that TANF caseloads have not grown as originally anticipated, both in 2023 and 2024, and this is just trying to be more reflective of where we see things going.
Thank you. And through the chair, why are agency contracts $25.6 million more than last year?
Entirely, Madam Chair, related to the state anti-poverty grant, $25 million.
Thank you. And through the chair on page 519, Human Services Medicaid, why has MMIS weekly shares report increased by about $6.8 million?
Madam Chair, as I mentioned in my presentation, this is reflective of the higher Medicaid cap payment we're required to pay New York State.
Thank you. And that could be the answer for the next couple. You can let me know that. Through the chair on page 520, Human Services Daycare, why has the public assistant benefits increased by $18.4 million?
So I'm going to expand a little more on this, Madam Chair. This appropriation budget for daycare subsidies is reflective of where we see enrollment going and the cost, the average cost of childcare. It is our best reasonable projection. I'm going to tell you, if you look earlier in the budget book, whatever the page we have within the Department of Human Services where we talk about childcare subsidies, I have a little note. You know what? I'm going to find, because this is important. Page 187, Madam Chair. Childcare enrollment for 2025 is projected at an average of 7,762 subsidy payments per month. That is, again, as I mentioned, based on our best projections, and we use the upwardly trending cost of subsidy cases to build the appropriations budget. We have more funding available than what we budgeted. So like we did a couple of years ago, Madam Chair, is include at the bottom of the page a little footnote saying that we really have funding to provide up to $97.9 million of subsidy benefits. But it seemed a little disingenuous a couple years ago, and it seems a little disingenuous today to budget $97.9 million if I don't really think that's where the spending is going to go. But everyone is clamoring for daycare. So this is important enough that we repeated what we did, and that's, we snuck in language saying when you adopt this budget, you're going to let us appropriate up to $97.9 million should the need arise.
Thank you. And through the chair, on page 521, Human Services Adolescents Care, why has public assistance benefits decreased by about $380,000?
Most of that, Madam Chair, in terms of dollars, is the result of anticipated lower costs from the state for juvenile justice facilities. That's Monroe County youth placed in state detention.
Thank you. And through the chair, on page 522, Human Services Child Welfare, why has public assistance benefits increased by about $3 million?
Madam Chair, that is not so much reflective of an increase in the number of placements, but rather the continually trending upward cost of a particular foster care placement, whether that's child welfare, federal 4E funded, or adoption subsidies. So this is really just reflecting the cost of each foster care placement.
Thank you. And through the chair, on page 524, Human Services Social Service Grants, why has this line item been eliminated?
I can't stand social services grants, Madam Chair. We have this, we have the grants in many departments, and we've been eliminating the use of this over the course of the past several years. So when the grant comes in, we're going to put that grant money in the actual division for which the service is provided.
Thank you. And through the chair, why has commercial services increased by $57,000? This was on page 525, Human Services Building Services.
Madam Chair, just trying to reflect again, the continuing increase in cost of Iron Mountain and the cost of printing.
Thank you. Through the chair, on page 527, Human Services Office for the Aging, what is the new 90,000 professional services? What is the 90,000 K professional services going to be used for, I guess?
This is really for internal contracts, not service provided, but we do have, I believe I mentioned, a new hub at Elite contract for $70,000 and a contract, $20,000 Daniel Jones for staff computer training.
Thank you. On the same page, why have agency contracts gone up by about $1 million?
Entirely, Madam Chair, reflective of New York State's allocation to Monroe County and our pass-through to our provider agencies.
Thank you. Through the chair, on page 528, continuing with Human Services Office for the Aging, factors behind the 17,000 change in total benefits?
Madam Chair, as I've answered previously, the cost of benefits is largely tied to the cost of payroll. So as payroll increases, we see commensurate increases in our pension and FICA, and it all also depends on the medical and dental plans selected by our staff and the cost of those plans.
Perfect, thank you. Through the chair on page 529, Human Services Youth Bureau Administration, why is 20,000 of temporary help being added as a line item?
Madam Chair, this is reflective of a seasonal clerk that has been requested. And again, seasonal staff will remain on temporary help where long-term part-time staff have been moved to salaries.
Thank you. Why is 12,000 of professional services being added as line item as well?
This supports school-based youth senate programming, Madam Chair.
Thank you. Through the chair on page 530, Human Services Runaway Homeless Youth, why did agency contracts raise about 116,000?
Again, Madam Chair, this would be reflective of the allocations we receive from New York State and is largely pass-through funding to our provider service agencies.
Thank you. Through the chair on page 533, Human Services Mental Health Administration, why did travel go down 46,000?
Travel, Madam Chair, has been cut countywide. We took a long, hard look at historical spending on county travel, going back to 2014, pre-pandemic, and where travel has gone since, I'll call it the end of the pandemic. And frankly, it was a difficult budget year. And when the travel costs are skyrocketing, that was a prime area for us to turn to. As this legislature has cut the travel budget in the past, we decided to look at that ourselves.
Thank you, I appreciate that. Through the chair, why was training non-computer eliminated as well as the computer equipment line being eliminated?
Well, I don't have the exact products listed in my notes, Madam Chair. This is related to one-time funding that was requested in 2024, not intended to be repeated.
Thank you. Through the chair on page 534, Human Services Mental Health, why is information services going down 29,000?
Again, Madam Chair, as we've previously answered, this really is the cost allocation from our Information Services Department to all user departments across the county and is largely dependent upon the licensing in those departments and the cost of what it takes to run our information services. So this is really formulaic.
Perfect, thank you. Through the chair on page 535, Human Services Mental Health Services Grant, why do agency contracts increase by 1.4 million?
Madam Chair, similar to the Youth Bureau and Office for the Aging, this is reflective of our allocations from the state of New York and reflect largely pass-through funding.
Thank you. Why is the IC2 purchasing being eliminated? And can you explain what it was used for?
Madam Chair, IC2 is shorthand for ICAP, Indirect Cost Allocation Plan. Our indirect cost allocation plan basically accounts for costs incurred by our staff departments, human resources, finance, et cetera. And those costs are allocated to the Department of Human Services and other departments for their reimbursement. Often referred to as federal A87 costs. We can get state reimbursement for our bureaucratic expenses. ICAP plans are created over the summer, months of June, July, sometimes spills into August, based on actual expenses incurred 2 years prior. So it would be costs incurred during 2023. So this is entirely formulaic.
Thank you, I appreciate that. Through the chair on page 536, Human Services Criminal Court Ordered Cases, why are agency contracts going up 2 million?
Madam Chair, this is completely reflective of the third quarter budget reappropriation referral we brought to the legislature back in August or September, when we transferred $2 million of safety net assistance to court-ordered cases. This budget request increase is completely in line with where we see this year's expenses going, and it's just incredibly expensive.
Thank you. And through the chair on page 537, Human Services, Opioid and Addiction Services. Can you explain the new division of opioid and addiction services and the new nearly 2 million in agency contracts?
Madam Chair, I think most people know Monroe County received quite a bit of opioid settlement funds from the Attorney General's office and from directly from pharmaceutical companies and distributors. The Office of Mental Health actually received their own opioid settlement dollars. These are dollars received by the state of New York and then passed through to local governments. So our Office of Mental Health has arranged a menu of programming going into 2025 to use their portion of the state's opioid settlement dollars that were allocated. The state has, I believe, 10 or 12 focus areas, which overlap quite nicely with our county executives' focus areas. So this is the programming to be used, Madam Chair.
Thank you. Through the chair on page 664, Human Services Financial Assistance. Do we know why the federal aid is going to go down 130,000?
Federal aid in total, Madam Chair, or specifically the first line?
I'll say the first line.
Madam Chair, we really account for our HEAP program, the Home Energy Assistance Program, as this federal aid, and that is reflective of the change in funding there, projected change in funding.
Thank you. And staying on the same page, why is FA Food Stamp Administration increasing by 88,000?
County of Monroe is reimbursed, Madam Chair, 50% of our food stamp employment expenses, our staff time. This is an estimate. Most people don't know how it really works, Madam Chair. We don't get reimbursed for the dollar we spend on food stamp administration. We rely on a random moment survey that the state conducts. So every month they call multiple of our workers, ask, what case number are you working on? And that case number has a category of assistance tied to it. New York State makes this phone call to all 6 of the large districts, Erie, Monroe, Ontario, Suffolk, Nassau, and Westchester. The state then averages all those return phone calls and then calculates a percentage of our staff time to reimburse in each particular program. So this is a best guess, Madam Chair, of what the food stamp reimbursement will look like for our administrative expenses.
Thank you, Mr. Franklin, for those answers, and I yield the floor.
Hi, thank you. Through you, Madam Chairperson, to the administration, on page 666, Human Services, the Children's Center. Assumingly, your answer from a minute ago is probably going to be the same, so you could just say so if that is the case. Why is state aid projected to increase by $6.2 million for that?
Reflective, Madam Chair, of the increase associated with Raise the Age law and our new to be coming online specialized secure detention center.
Thank you. Through the chair to the administration, on page 667, safety net. Why do repayments of safety net increase by 500,000?
Trying to better reflect, Madam Chair, the collections we've received for the past couple of years, get our budget in line with that.
Thank you. And through the chair, on page 671, Human Services Adolescent Care. Why do repayments of adolescent care fall by 8,900?
We can research that, Madam Chair, and respond.
Thank you. Through the chair, on page 683, Human Services Opioid Addiction Services. Was this department created due to the anticipated $1.95 million in new state aid?
Actually, Madam Chair, it was created a couple years ago when we started the impact team, and there was debate whether we were going to create this unit in OMH or public health, and ultimately we settled on public health. So it is a recycled cost center that's going to be used for the opioid settlement dollars.
Great, thank you. Through the chair to the administration, did you, some personnel questions, did you fill the 15 additional youth detention worker positions that were added to the 2024 proposed budget?
They have been, Madam Chair.
Excellent. Through the chair to the administration on page 733. Why was the CF&S Quality Assurance Control position dropped from Group 18?
I'm sorry, Madam Chair, could you repeat the question, please?
No worries. Through the chair on page 733, why was the CF&S Quality Assurance Coordinator position dropped to a Group 18?
Yes, thank you. We had that position filled previously. It was a position when we had Bonadillo in place, a recommendation that came through when we had the external monitor. Upon hiring that individual, we had an opportunity to assess the position because we were trying to be very competitive when we first did the position as a Group 20. So working with the team and reevaluating and just kind of aligning that position with other positions we had in the department, we made the agreement to bring it down to a Group 16, which aligned with some of the positions that are under the Planning and Research Department, which is where that QA position sits. So a Group 20 would be in line with that director, and it just didn't make sense to do that.
Okay, thank you. Continuing on page 733 through the chair, why was the printer position eliminated?
Madam Chair, the print shop has been moved from the Department of Human Services to our Office of Communications and Special Events, as it was several decades ago.
Thank you. Through the chair to the administration, will the additional caseworker supervisor position be filled?
Madam Chair, to be frank, the goal in every department is to fill all their authorized positions.
Thank you. You essentially answered 7 questions in one with that answer, so thank you very much for that.
Like that efficiency.
Through the chair, continuing on page 733, why was the energy program evaluator raised from a Group 50 to a Group 51?
Through the chair, I believe energy evaluator?
Yeah, I'm sorry, energy program evaluator.
Energy program evaluator. During that is a position that's covered by the Federation of Social Workers, and in our contract negotiations and a subsequent agreement, that was a position that was upgraded to align more with the examiner position. Through the chair.
Thank you very much. And next question through the chair to the administration. Any other changes to personnel that we should be made aware of at this time that haven't been mentioned? And if so, could we have a full list of any of those changes?
No, Madam Chair, there's nothing more that this group should be aware of.
Thank you. Moving on through the chair to the Department of Public Health, the budget analysis questions. Well, you know the question about mandated and unmandated costs for the Department of Health.
Familiar with that question, can it please be asked?
Absolutely. But I will ask through the chair, can you provide the legislature with a breakdown of all positions that fall under this portion of the 2025 budget that are authorized, funded, and vacant? Each title corresponding with the budgeted amounts for salary, retirement, Social Security contributions, so on and so forth.
We'll follow up, Madam Chair.
Perfect, thank you. Through the chair to the administration, Administration and Special Services objectives for 2024 include conducting a biohazard detection system exercise with the U.S. Postal Service, applying to conduct a presentation at the National Association of County and City Health Officials Preparedness Summit, but they do not appear in the 2024 major accomplishments. Do you have any updates on these objectives, whether they were met or not?
Through the chair, yes, the team presented and they actually did a fantastic job, got really good feedback.
Excellent. Through the chair, maternal and child health services objectives for 2024 include transitioning from paper charting and implementing a new electronic health records. But again, it doesn't appear on the major accomplishments. Was this goal achieved?
It was.
Love these answers, by the way. Through the chair to the administration, Office of Medical Examiner objectives for 2024 include DHS integration into assisting OEM with the next of kin identification and contact, but again, this doesn't appear on major accomplishments. Was this goal achieved?
Through the chair, yes, this was achieved. We are getting a lot of good help from them.
Through the chair, environmental health objectives for 2024 include creating a computer-based system at rabies vaccination clinics. Was this goal achieved?
Through the chair, this goal is still in progress.
Through the chair to the administration, on page 293, projections for disease investigations have been low the last few years. Do you think that the 2,100 number, target number, will be correct this year?
Through the chair, yes, that is our best estimate.
Thank you. Through the chair, on page 538, Public Health Administration and Special Services. Salaries are going up more than $475,000. Do you have increases in salaries, or have you filled vacant positions, or both?
Madam Chair, that increase in salaries is reflective of changes in staffing, contractually required pay and step increases. Most of the staff in public health are CSEA. They have a tentative settlement agreement to be voted on either at the end of this month or really early January. So we added additional dollars to try and compensate for what we believe would be the ultimate settlement of pay increases. I will say, offsetting all of that, we did apply a 5% vacancy factor throughout the Department of Public Health on positions.
Thank you. Through the chair, the temporary help decreasing by 28,000, that is just a reallocation, or
It is.
just moving people to different lines?
It is, Madam Chair. Part-time staff are now included within salaries.
Thank you. Through the chair, again, on page 538, why is there shift differential pay in this year's budget after not having it last year? Was that something that was contractually agreed upon?
All pursuant, Madam Chair, to our collective bargaining agreements. Basically, addiction services are now expanded their street outreach into the early evenings, and that has a bargaining component to it.
Thank you. Through the chair, why is there $0 going towards occupational exams after budgeting almost $30,000 for it last year?
Most of that, Madam Chair, is probably because 24 budget was overstated through COVID and the incredible hiring of part-time and temporary staff within public health. This is a OMB, Office of Management budget spread, so departments are no longer budgeting that themselves. We spread a countywide cost to all departments.
Thank you. Through the chair, why is there a $274,000 raise in commercial services? And why did we spend over $1 million this year, but only budgeted $95,000 for it in 2024? The
$1 million, Madam Chair, in 24 is all related to grants that have been accepted by this legislature throughout the year and will likely come before the legislature during 2025. Having said that, I will say, budget to budget, we are adding money into addiction services, primarily for their media campaign to the tune of a little over $200,000.
Thank you. Through the chair to the administration, and other expenses that was eliminated, the line was completely eliminated. Is there a reason for that?
Madam Chair, I really don't like other expenses and work with the departments to put that expense where it really should belong.
Thank you. Through the through the chair to the administration, can you explain the new public notices line item for $55,000?
All related, Madam Chair, to the work to be done by our impact team in addiction services.
Thank you. Through the chair, why is there a drop of $15,000 in agency contracts?
Madam Chair, this is also related to a reduction in addiction services, and likely the department management team wanted to reallocate that for its public notices in the public service campaign that they envisioned for 2025.
Thank you. Through the chair, then going to page 539, assuming that's the same answer for why is the information services line being cut almost in half?
Information services, Madam Chair, again, is wholly dependent on the, as I think I framed it before, the generic costs within information services, those administrative and bureaucratic costs not tied to specific software products or licensing agreements that are spread to all user departments by a ratio of a variety of ratios, FTE, laptop assignments, SAP user licenses, et cetera.
Thank you. Through the chair, going to page 540, Public Health Nursing Services. Why is the software licensing up $170,000 from last year's proposed budget?
Madam Chair, the amended budget is also $170,000. It's very little change, but this is entirely reflective of the product is Patagonia, so it's a software license. I believe it's an electronic health record. Yes. And Madam Chair, I'll point out, since the question will come up, the Patagonia software can be found just a couple rows beneath in maintenance computer equipment. Everyone used to think it's computer equipment maintenance, but new GASB, Governmental Accounting Standard Boards, has a new way of tracking the cost of subscription-based IT licensing. So we're trying to aggregate all these costs on software licenses.
And yet again, sir, you are a
Anticipatory
genius, and your
questions.
anticipation is incredible. That was the next question.
It's like there's a pattern.
Ironically enough, as much as I like to hear myself talk, I yield the floor.
Legislator Brew, did you have some questions?
Thank you, Legislator Dondorfer. I do have a few questions. Through the chair to the administration, to start out with what we just recently heard about the opioid overdoses for the year 2023. With the 25% increase, is there something the county could be doing differently, citing the number, the percent increase in overdoses?
Through the chair, our team is constantly evaluating what new novel techniques and strategies could be used. Moving forward, we are certainly planning to implement, as has been alluded to, a public service campaign focusing on addressing the stigma around substance use disorder, helping the public understand the Good Samaritan laws, highlighting our community partners that have accepted nalox boxes in their establishments, and highlighting the work that the team is doing there. We certainly are planning to extend some of the outreach that our team does to survivors of overdoses at times of the day when most substance use occurs. So that will be later into the evenings and the morning hours. So that will be a change. It's obviously a challenge to hire folks for night shift in any area, specifically staff that have the particular skill set that is required to form a therapeutic relationship and a rapport with substance use, people who use drugs and are suffering from a substance use disorder. So that hiring has been slower than we would have liked, but certainly having those staff be able to go out and meet people where they are when they're considering using, when they're using, and offering them harm reduction techniques, equipment, and connection to chemical dependency treatment is something that we plan to increase over time.
Thank you. Through the chair of the administration.
Excuse me, Madam Chair, if I could just add to the doctor's response. One of the other things that we're looking at is the creation of a fatality review committee. There are some factors complicating our efforts to create the committee. There's confidentiality information, and who has access to all of the data that we need is extremely limited. But what we're working on, NISAC is pushing, and we're proud partners in this, to try to get changes made to the state law that would free up access to that information. We do have the ability to work with families that have lost loved ones to this who would voluntarily participate in this. And what we're looking at doing is having a multidisciplinary team review these fatalities that would be made up of the county, the city, the hospital systems, service providers, with the idea to have more of a real-time analysis of what's going on. And as a result of that, we're also looking then at having a better coordinated response to what's happening out there. And as the doctor said, my sense in terms of the efforts of the health department have been very robust. And unfortunately, as we see those numbers increase, that's not something we're happy about at all, but we're particularly proud of the saturation that we have in this community of the naloxone the distribution. There have been tens of thousands of doses distributed in the community, and the announcement today that there was a significant increase last year is disheartening by all means, but we are committed to do everything we can to make improvement on those numbers.
Chair, thank you. Thank you to the administration. I guess as a follow-up question to the administration regarding the reporting year, it's almost the 1st of December, and we're just learning the 2023 results now. Is there a reason for that those results are not made public till almost later?
Yes.
Through the chair, my response would be yes, it is, because we're talking about budget allocations to these departments. And I'm going to be getting to a question later on in my dialogue, is if there's anything that this legislative body could do budget-wise to support the efforts of addressing this problem.
Okay, Mr. Brew, ask your question.
Through the chair, yes, there is a significant delay. According to national standards for the functioning of the Office of the Medical Examiner, for the number of cases that our office sees, to be fully staffed, we would need to hire 2 additional medical examiners to have a staff of 5 forensic pathologists just doing autopsies day in and day out. We only have 3 at the moment, and U.S. medical schools are not graduating enough pathologists, much less folks that then go into forensic pathology, to be eligible to fill these roles. And so that has led to a significant backlog in numbers of cases. And this body is certainly aware of the level of detail of information that is required to be generated from those autopsies and be shared with our district attorney's office in order to prosecute sellers of these illegal substances for applying charges of homicide when some of their clients, for lack of a better term, do overdose. And so it's not a simple test of was there an opioid or an opioid metabolite present in the body, yes or no. Our staff is being asked to provide very detailed toxicological reports about was it a metabolite of legitimate medications or of heroin and other illicit substances. So a lot of that testing does take time, and we are doing our level best to recruit more folks to do the work, and we are certainly grateful to the administration for providing us increased positions for other staff positions, our technicians and et cetera. But it is really hard to attract folks to come and do autopsies in Rochester when they could, be working in sunny Florida or New York City or other larger areas.
Thank you. And through the chair, just a follow-up comment regarding the budgeting. So your response did indicate the administration's been supportive in terms of providing those positions. It's the filling of those positions that provides the difficulty in the shortage of the professional services to fill those.
Through the chair, that is definitely one aspect, yep.
Thank you. And on to a few more, just a handful. Through the chair, to the administration, on page 541, continuing public health nursing services, why is the information services dropping by $45K?
Answer is on other pages, the allocation of bureaucratic information services expenses not tied to specific software products or licenses.
Okay, thank you. And through the chair of the administration, on page 542, public health, maternal and child health services, why are salaries increasing by $36K?
Madam Chair, all reflective of required pay and step increases, plus our additional allotment to try and account for a CSEA contract settlement. Again, all offset by a 5% position vacancy factor on this line.
Thank you. To the chair of the administration, why is overtime being eliminated?
Madam Chair, it was $1,000, and it was not spent in 2023. So the department is going to use that $1,000 somewhere else.
Okay, thank you. Why are agency contracts going down by about $44K?
Most of that, Madam Chair, is a reduction in our $46,000 reduction in URMC, specifically a home care contract, nurse-family partnership, and for that, our payments to VNS. This is another area where you likely will see a legislative referral come before this body during 2025.
Thank you. Through the chair, on page 543, continuing public health, maternal and child health services, any main drivers behind a 26K reduction in total benefits?
All commensurate, Madam Chair, with the change in payroll.
Any other drivers behind the 51K change in total interdepartment charges?
Madam Chair, all the drivers of that change are separately delineated on this page.
Through the chair, on page 544, public health medical examiner, why are the salaries going up by $502,000? Has the ME office hired people to help with the backlog of cases?
They have, Madam Chair. This proposed budget for 2025 does reflect the addition of 7 3/4 FTEs. Again, required pay and step increases, the additional allotment for CSEA contract settlement, and again, all offset by a 5% position vacancy factor.
Thank you. Same page. Why is temporary help being eliminated?
Temporary help, Madam Chair, in the medical examiner's office was all related to part-time staff, which will be accounted for in the salary line.
Why is overtime going down by, through the chair to the administration, why is overtime going down by $36,000?
The theory behind that, Madam Chair, is with the additional staff, the need for overtime should reduce commensurately.
Through the chair of the administration, why is standby call-in pay going down by $10K?
All reflective, Madam Chair, of collective bargaining agreements and the addition of additional staff.
Through the chair of the administration, what was a capital budget project in 2024 amended budget?
That, Madam Chair, was an amendment that came before the legislature several months ago. I think it was August when it was requested and authorized to provide cash funding for certain capital projects within the medical examiner's office, primarily for lab equipment, Madam Chair.
Okay, thank you. Same page through the chair. Why are gas and electric prices going down? Combined 50K.
Madam Chair, our proposed budget for 2025 for all utilities, steam and water, gas and electric, are based on recommendations from our energy consultant, Fluor Energy.
Thank you. Through the chair, on page 545, continuing public health medical examiner, why is equipment going down by 37K?
In 2024, Madam Chair, there was one-time funding, about $35,000 for autopsy equipment.
You. Same page, through the chair to the administration, why is retirement going up by 70K?
Retirement costs, Madam Chair, across the county are going up. The pension expense for 2025 is significantly higher than the pension expense for 2024. All reflects an increasing payroll in this county and the number of retirees.
Thank you. So through the chair of the administration, you would consider the majority of that expense being additional liability to the pension system, correct?
The pension bill, Madam Chair, is going up about $8 million.
Astounding.
Yes, Madam Chair.
Through the chair, on page 546, continuing public health medical examiner, any other drivers behind the 40K decrease in interdepartmental charges?
No other drivers, Madam Chair, than what is separately delineated on this page.
Okay. Through the chair, on page 547, public health, environmental health services, why are salaries going up by 70K?
Although there is a very small 1/10 reduction in staff for environmental health services, again, as I've said, this is all reflective of contracts required pay and step increases, the additional allotment for a potential CSA contract settlement, and again, all offset by a 5% position vacancy factor.
Okay. Same page, why are agency contracts being eliminated from 4.7 million in 2024, which was budgeted for 310K?
It was originally budgeted for 310K, Madam Chair, reflecting the payment to the city of Rochester for its lead programs. Those are all, was previously grant funded. We lost that grant, but still provided funding to the city of Rochester. I'm happy to say during 2024, we received almost $4.4 million worth of multi-year grants, of which the city's lead program will be covered under that grant program.
So through the chair of the administration, you're saying that we did recover that 1 year of loss of grants?
That's right, Madam Chair. It was a multi-year grant accepted by this legislature. Multi-year grants are programmed in SAP as the years come, so there's no need to account for them separately in our proposed budget.
Wonderful, thank you. Through the chair, page 548, continuing public health, environmental health services. Why is information services going down by 53K?
Same answer as before regarding information services, Madam Chair.
Through the chair, page 549, public health, early childhood development. Why are salaries going up 152K?
Conversely to what I've said about a couple other divisions, early childhood development is adding almost 1.5 FTEs in staff. Again, I will comment on required pay and step increases, collective bargaining, since it's predominantly staffed by CSEA, all offset by a 5% position vacancy rate.
Okay, and through the chair of the administration, a similar question's been asked, but why is overtime nearly eliminated?
Madam Chair, it's $1,500, and the department chose not to fund overtime since we are adding staff.
Through the chair, why is public assistance benefits line going up over 12.5 million? And can you describe what those dollars go into for this division?
Public assistance benefits, Madam Chair, for early childhood development. Early childhood development is, I think this is the second or third year we're calling it by that. This is reflective of our early intervention and preschool special ed program. As I mentioned in my presentation, a significant increase in public assistance benefits, which is overwhelmingly driven by an increase in transportation costs. To a lesser extent, increasing cost in itinerant teachers.
Thank you. Through the chair, on page 551, Public Health, Epidemiology and Disease Control. Why are professional services being eliminated from 30K budgeted this year and 65K amended?
This originally had a contract with Common Ground Health, and I do not believe that contract is moving forward in 2025. Going to correct me? Much smaller? We're going to get to a correction, Madam Chair.
Through the chair, it's just a smaller contract this year.
Thank you. Next, on page 684, Public Health Administration Special Services, why is the SA-PH Article 6 line going down 29,000?
So, although I don't fully know the program of Article 6 reimbursement, Madam Chair, it is a reimbursement program, but not all health department expenses are eligible for reimbursement. It depends on the specific programs and divisions they work within, and even the fringe benefits that are they elect.
Okay, thank you. And through the chair to the administration, why are anticipated fees increasing by 54K?
All related to our Office of Vital Records, Madam Chair.
Okay. Next question, I only have a couple more here. Why are charges to trust funds going up about 642K?
Charges to trust funds in this division, Madam Chair, reflect the operating expenses budgeted for the impact team, and we have the opioid settlement trust fund for which those expenses are reimbursed.
Okay. My last question, through the chair on page 685, Public Health and Nursing Services, why is the SA-PH Article 6 line going up about 148K?
Again, Madam Chair, it all depends on the programs for which eligible expenses have been assigned, and it's very formulaic.
Thank you. Yield the floor.
Further questions on the budget? Yes, Legislator Cruz.
What are the contracts that are included in this increase?
I think I missed the page number reference, Madam Chair, I'm sorry.
550, I think.
530.
Oh, sorry, 530.
Through the chair, the contract is with the Center for Youth, so they provide that service to the county. They provide emergency housing, counseling services. They work with the families also in regards to this work.
Thank you. On page 188, the Allison Care, I see that the juvenile justice facility decreased by 380,000. Can we know why the decrease in this area?
Yes, Madam Chair, this line is entirely reflective of Monroe County youth in state detention facilities, and it's the charge we receive from New York State OCFS.
Thank you. I yield the floor.
Any other questions on the budget? Yes, Legislator Milne.
Thank you. Just a couple of questions. really surrounding personnel. Through the chair, on page 743, why was the pharmacist position eliminated?
Through the chair, that pharmacist position was really key during the pandemic when we were managing massive amounts of vaccine mobilization to different eligible groups. If you all will recall how not everyone was eligible at the same time, and then the vaccine was available for children. So that level of complexity, the pharmacist was really, really critical during that phase. And we found that as the pandemic came to a close, we did not have sufficient work to continue that position full-time.
Thank you. And I'm going to ask about some other positions, all on page 743. What is the new fiscal coordinator position?
Through the chair, that is a personnel dedicated to really just help our department manage all of the grants, all of the financing, all of the budgeting.
Thank you. And again, along the same lines, what is the new health business operations coordinator position? Bless you.
So this is a position that was created in the medical examiner's office to try to offload some of the non-autopsy work from the medical examiners to just more like run the operations that were not specifically the medical work, that we really want to maximize the amount of time that our forensic pathologists use to do the autopsies and get through the backlog.
Thank you. And again, I know it's always a challenge to hire people or find the right people, but are we anticipating, or what is our thought process on hiring 4 additional medical investigator positions? Are we in process with that?
Through the chair, yes, those searches are continuing.
And will the 3 additional community health worker positions be filled? Are we, again, in process with that?
Through the chair, correct, in process.
Thank you. Thank you. And one other question for the medical examiner before I move to Monroe Community Hospital. But through the chair to the medical examiner, is there anything this legislature can do in this budget to help reduce your caseload? We know we've talked about that a lot over the last couple of years. And if we're waiting, I would be happy to move to a couple of questions on Monroe Community Hospital. There's someone here that can. And really performance-related questions through the chair to the administration. In last year's budget, a major objective listed was to finalize interior renovations to create Friendship Place. But this year, a major accomplishment for this year is just re-engaging with New York State Department of Health to revise scope and resume Friendship Place project. What is the update on that project?
Through the chair, we had to modify our architectural design to meet our budget. Therefore, we had to re-engage New York State and receive approval for a modification of a certificate of need, which has taken us quite a bit of time. So we actually yesterday did just receive approval of our modification. There are a few more steps to be approved before we can actually re-engage in the construction, but we are getting close.
Good. And through the chair, we're going to continue on with MCH for right now. Were you able to complete the 2024 major objective of attracting tenants to unoccupied space at MCH?
Through the chair, we did have county cybersecurity come into MCH for space. We currently do have a lead with GV BOCES LPN program to at least come in and review space for their needs as well.
Thank you. And we're on page 553 actually now. Through the chair, why is the recruitment expenses line item being eliminated?
Sorry, Madam Chair, recruitment expenses, can you identify the commitment item by number?
My computer is now off. Oh. Page 553. Sorry.
What was the question?
Pardon me? Oh, right. I think it was in last year's budget and it's been totally removed.
Madam
501060, as I hear.
Madam Chair, if that was in last year's budget, those appropriations would have been transferred to a different line, probably within personal services, since it's a 501. I'm going to take a wild guess. I don't have my 24 budget book with me. That might have been a placeholder for healthcare worker bonus funding.
Okay, thank you. And obviously, if that's different, I'm sure you'll get back to us. On still 553, why are taxes and assessments going up by roughly $677,000? What creates
Madam
that?
Chair, while I generally defer to MCH because they are the experts, I happen to know about taxes and assessments. It is basically a gross receipt tax on the services we provide. So as we budget for an increase in patient revenue, with that comes an obligation to pay tax.
Thank you. I believe remaining on 553, what is the bad debt expense line item? It's a $50,000 decrease, which I'm not worried about per se, but what is that? Is that just for payments that are not made to MCH?
That's exactly what that is, people who don't pay their bill, Madam Chair.
Thank you. Moving to page 554, I noticed that medical supplies are going down by about 488,000. Pharmaceuticals are increasing by 199,000. Is that simply cost and cost changes? Are we getting a better deal on our medical supplies this coming year? And maybe the increase in price on the pharmaceuticals?
Through the chair, our reduction in medical and lab supplies is based upon our current utilization. So we have seen a slight reduction as compared to in the thick of COVID. Additionally, we were able to secure supplies from the state and Monroe County to be used throughout 2025. So we were able to save there. And related to your question on pharmaceuticals, based on projecting an increase in census, we would see an increase in pharmaceutical cost. We do attempt to utilize generics when able, but we do see some more expensive medications being utilized by our patient population coming in.
Thank you. And on page 691, we see patient revenue increasing by 1.6 million. Is that more patients, more payments being received, both?
Through the chair, that would be a combination of both.
Yep. Perfect. Perfect. I'm going to have a couple questions for the Veteran Service Agency, but I just wanted to go back to the other question. Is there anything we can do to help the medical examiner in this budget?
I mean, through the chair, the only other consideration would be to look at the salaries that we can offer to try to attract, more forensic pathologists, and we need to also consider, that some of our neighboring counties are also recruiting at the same time.
And a follow-up question to that. With what we see, are we lower in salary than our surrounding counties and across the state or Northeast?
I will have to get back to you with those details. I don't think we are very far off if we are.
Thank you, thank you. And if I could ask just a couple of questions, performance questions for the Veteran Service Agency, I'd appreciate that. We good? Through the chair to the administration, in the Veterans Agency 2024 objectives, it was to continue maintenance and improvements to the War on Terror Memorial and complete installation of flags. Were we able to do that?
Through the chair, yes, sir, we were.
And through the chair, in the 2024 objectives, the Veterans Service Agency said they intended to add a case manager to support Veterans Treatment Court. Was this achieved?
Through the chair, no, sir, it was not. That case manager was historically paid for by a Bureau of Justice Assistance contract through the Veterans Outreach Center. We intended to insource that position when the BJA grant expired. The VOC chose to continue that function on their own with their case manager at no charge to the county.
Thank you. Just a couple of other questions. Through the chair, throughout almost every division of VSA, why has the retirement line gone up so much since 2022? Is it just people timing out, or?
The retirement line, Madam Chair, again, is reflective since 2022 of the additional staff that work in the Veteran Service Agency and the increase each year in our pension bill.
Thank you. Appreciate that answer. On page 556, again, minor item, but it's just an interesting item to ask for me. Why did the commissary go up from 600 to 6,000? Is that just we're doing something different within the process?
Through the chair, the increase in commissary is to provide food for the Veterans Open Group, a program that we're running at the Equicenter. The previous $600 was simply for coffee and drinks at the VSA headquarters.
Thank you very much. And then my last and final question, there seems to be quite a few personnel changes in regards to an increase to a full-time Veterans Counselor, Group 14, Counselor Group 14, full-time to part-time Veterans Court Community Liaison, Group 12, Veteran Therapy Liaison, Group 12, removal of a Veterans Court Manager position, Group 13, 2 additional County Service Officers, Group 12, and the addition of 2 receptionists, Group 5, totaling four more total positions than the 2024 budget. Just filling needs?
Through the chair, to run through them individually, the Veterans Counselor position was a part-time position. It was transitioned to a full-time position to meet the requirements for the Veterans Nature-Based Therapy Program. Same thing for the Veterans Treatment Liaison. That person recruits for the Veterans Nature-Based Therapy Program, and there wasn't enough time in the week for him to get out and do the things that he needed to do. For the Court Manager position, I just addressed that. That was the position that was the VOC is continuing to man. The additional county service officers and the 2 receptionists were included in Resolution 232 of this year that are the ARPA-funded programs for the satellite offices.
Thank you very much for all those answers. I yield the floor.
Other budget questions? Yes, Legislator Cruz.
Madam Chair, you don't see many of the appropriations associated with homeless services. I'm not going to articulate this well. Homeless services is not specifically a program. It's a payment type within social services, so the biggest expense show up as the public assistance benefits, whether in family assistance or safety net assistance. You will see in this budget, as questions were posed a little earlier on on different pages of Human Services. We talked about our lease of Troop Street. That is the county-run shelter. What you really see in the budget book within the Financial Assistance Division, kind of generically, is our lease for Troop Street. The services provided to the temporary residents at that shelter are really provided by VOA, and the way we pay them is through public assistance benefits. We actually have a payment type within the state payment system that shows as a shelter payment. So that's not something specifically identified in the book. Madam Chair, that would likely take the form of a narrative, not a presentation of dollar amounts. It's all system-driven. And I know we are transitioning to a new financial enterprise system, but again, all these dollars are driven by the source of the payment in the program for which the payment originates. So it would likely take the form of a narrative.
All right, any other questions on the budget? Going once, going twice. All right, thank you, Mr. Franklin, for your patience and diligence tonight, and to all of the human service representatives and public health representatives. We so appreciate you being here and answering our questions and your service and dedication to the people of Monroe County. Thank you so much. All right, moving on. Next item on the agenda is the approval of minutes. You have the October 22nd, 2024 meeting minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. Next item on the agenda is new business. Madam Clerk?
Referral 24-0376, authorized contracts to provide temporary respiratory therapy staff at Monroe Community Hospital.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Do we have any discussion? Seeing none, all in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0377, acceptance of funding from the New York State Office of Mental Health and the New York State Office of Addiction Services and Supports, and amend Resolution 471 of 2023, authorizing contracts for the provision of mental health, developmental disabilities, and alcoholism and substance abuse services in 2024 for the Monroe County Office of Mental Health.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral 24-0378, authorized contracts for the provision of mental health, developmental disability, and alcoholism and substance abuse services in 2020 and 205 for the Monroe County Office of Mental Health.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Yes, Legislator Milne.
How many patients do these contracts hope to treat and evaluate throughout the year?
No, it works. Through the chair, sorry. It's late. Through the chair, roughly 43,000. We've estimated that in 2023, so hopefully that goes up. We'll have a better answer later on.
Thank you very much.
You're welcome.
Further? Seeing none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 24-0379, authorize intermunicipal agreements with municipalities for Rochester Monroe County Youth Bureau programs in 2025.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Legislator Smith.
Thank you. Through the chair, what metrics are used to determine the outcome and benefits of these programs?
Through the chair, each vendor chooses which youth development area that they want to focus on. So per se, social and emotional, then they will report back on that. We also use some basic demographical stuff like attendance, how many times a youth, does a particular activity. So there's a variety. It just depends on the vendor and the program.
Thank you. Through the chair, why is the town of Gates not part of this? Did the town not apply?
Through the chair, this was done through a process, EOI, expression of interest, and it's prior to my tenure here, but I believe that is the answer for that.
Thank you. I yield the floor.
Seeing none, all those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Item carries. Next item, please.
Referral 24-0380, authorized contracts with not-for-profit agencies for Rochester Monroe County Youth Bureau programs in 2025.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Any discussion?
Yes.
Yes, Legislator Dondorfer.
Thank you. Through the chair to the administration, how have these programs performed over the past year? And do you have any KPIs that we can have?
Through the chair, the programs are performing well, and we do have some reports and demographic information that we can provide.
Thank you very much.
Legislator Cruz.
Also, can we get a list of the, I see a list of 29 contracts, so I'm assuming 29 are working with the Youth Bureau, or will be granted? Would that be correct?
Through the chair, each agency will receive a unique amount that we can provide.
Hey, I'm sorry, I think I was all over the place there. Get a list of the agencies. I see a list of number 29, so I'm assuming there's 29. Would it be either applying or be given these funds?
Through the chair, yes.
And through the chair, I just need a little bit of clarification when it mentions that the 29 contracts each year is in the amount of $20,000 with matching funds required from the runaway and homeless youth providers only. So are these agencies required to match $20,000 or the amount of money given to them by the county?
Through the chair, each agency provides a budget for the program, so there's not a specific dollar amount.
Okay, so I'm assuming, just as an example, through the chair, if an agency says, here's the budget of $5,000, the county would then match them $5,000?
Through the chair, once again, it's not a dollar-for-dollar match. Each program will submit a proposal and a budget.
Okay, then through the chair, then can we clarify what do we mean by with matching funds required?
Yes, through the chair, we'll submit an answer for that question.
Thank you. That'll be all.
All right, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 24-0381, amend Resolution 318 of 2022 to increase and extend the contract with United Way of Greater Rochester, Inc. for the Monroe County Age-Friendly Implementation Plan for Older Adults.
Madam Chair.
Second.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0382, authorization to contract for Monroe County Office for the Aging programs in 2025-2026.
Move it, Madam Chair.
Second.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Legislator Brew.
Thank you, through the chair to the administration. What senior recreational and educational services?
Through the chair, could you repeat the question, please?
Certainly. Chair, what senior recreational and provided through these contracts?
Oh, for the senior centers, there are a variety of educational recreational programs. They're primarily chosen by the center coordinator. These can range anywhere from chai tea classes to book reviews. Also, there's a physical component in that there are like cardio folks coming into each center. We also have performances by various musicians within the county that perform at these centers. Through the chair.
Thank you. And just to follow up, so my takeaway is that it's pretty wide ranging in those services provided.
Through the chair, it is, and it's mostly predicated on that center, where that center is located and what the interests are of the participants. Through the chair.
Thank you. That's all I had.
Any further discussion? Yeah, Legislator Cruz?
Through the chair, similar to the last, can we get a list of the 47 contracts that will be given out? Or should be on file.
Yes, through the chair, these contracts should be on file at the clerk's office.
Should I ask the clerk for a copy or myself about it?
Through the chair, yes.
Can we also get a definition, but the same thing with the matching of funds, a clarification in that part?
Yes, depending on the funding stream, all programs, I shouldn't say all, most programs require a match. I'll give you an example of that. The Community Services for the Elderly is a program funded through the New York State Office for the Aging with a 25% match. Older Americans Act Title III-B is an example of a match of 10%. So they vary depending on funding stream and whether they're federal or state dollars. Through the chair.
Through the chair, one last thing. Can we get a little bit more extensive explanation of that in writing to the caucus at a later time?
Through the chair, can you repeat the question, please?
Could we get a more elaborate or extensive explanation of what you just mentioned in writing to our caucus so I could better study it?
Oh, sure. So you'd like a list of match and relation to the funding streams?
Correct.
Yes, through the chair, yes, we can.
Thank you very much, and thank you for your patience. I'll give my time.
Further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 24-0383, authorize intermunicipal agreements with Orleans County, Genesee County, and various other counties for services provided by the Monroe County Department of Public Health's Sexual Health Clinic.
Move it, Madam Chair.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Yes, Legislator Milne.
Yes, through the chair to the administration, how many patients does this program, does Monroe County anticipate treating through these IMAs?
Be the first year of this particular contract, and so we don't know for sure. We have grossly overestimated the amount of money that will come in because we mimicked the contract that we have for a similar contract with Genesee and Orleans for the TB program. We anticipate probably 100 or fewer people during the first year, but that's a guess.
Thank you very much. And a follow-up question, if I may, through the chair. Quite honestly, why is the county choosing to participate in this IMA for the first time? What drove us to this?
Through the chair, there are many people who live in the other counties who work in Monroe County, and so they show up at our clinics, and if we can see them and bill insurance, we can do that. If they're not Monroe County residents and they don't have insurance, we're really not supposed to take care of them. And so this allows us to provide care for those individuals.
Excellent. Thank you very much for your answers. I yield the floor.
Any further discussion? All right, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0384, authorize intermunicipal agreements with Orleans County, Genesee County, and various other counties for services provided by the Monroe County Department of Public Health's Tuberculosis Control Program.
Madam Chair.
By Legislator Vasquez Simmons, seconded by Legislator Cruz. Any discussion? Legislator Smith.
Thank you, Madam Chairwoman. Through the chair, have we or our neighboring counties seen an increase in tuberculosis patients?
Through the chair, that's an interesting question. There was this big pandemic that suppressed numbers in an artificial way. And so what we're seeing during our current year is normal numbers. We have, as of this date, this year, we have 17 active tuberculosis cases, and that's kind of normal for our previous average before the pandemic.
Thank you. I yield the floor.
Further discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0385, amend Resolution 126 of 2019 to accept additional funding from the New York State Department of Health and extend the time period for the High Impact Prevention Within Communities of Color program. Amend Resolution 521 of 2021 as amended by Resolution 47 of 2022 and Resolution 109 of 2023 to amend and increase the contracts to provide nursing and healthcare provider services for the Monroe County Department of Public Health.
Madam Chair.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Any discussion? Legislator Dondorfer.
Thank you, Madam Chairwoman. Through you to the administration, what number of nurses and staff will be provided to work with the Department of Public Health on this?
Through the chair, there is one designated full-time nurse who's assigned to this project as the outreach coordinator. And in addition, we have a contract that has been previously approved by this legislature for some per diem nursing service so that during peak times we can staff up. We also have a community health worker who's assigned to assist.
Thank you. And through the chair to the administration, how does the Department of Public Health plan on linking women and communities of color to healthcare providers?
Through the chair, we have relationships with most of the healthcare providers in the community, and in particular, those healthcare providers who provide the type of care that we're looking for these women. We find the women by going out into the community and providing testing, and then offer them linkage, offer them information, encourage them to follow up when we get positive tests.
Thank you. I yield the floor.
Further discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0386, acceptance of a grant from the New York State Department of Health for the high impact prevention and services that address social determinants of health and reduce health disparities within communities of color. Component C, prevention and essential support services for women and young women within communities of color.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0387, acceptance of a grant from the New York State Department of Health for support of the Monroe County Nurse Family Partnership Program.
Madam Chair.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Any discussion? Yes, Legislator Brew.
Yes, yes, thank you. And through the chair to the administration, how many high-risk mothers and families did this program treat last year? And do we expect to see an increase in high-risk mothers and families?
Through the chair, we served about 150 families in the last year and are on par to serve about the same amount this year. We are in the process of hoping to hire another nurse And with the evidence-based model, our case numbers are limited by the number of nurses we have. So with an additional nurse, we'll be able to serve additional people.
Thank you. I say the same thing every year. I love the Nurse Family Partnership Program. Thank you for what you do.
Further discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0388, authorize a contract with Nurse Family Partnership National Service Office for support of the Nurse Family Partnership Program.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0389, acceptance of a grant from the New York State Department of Health for the Tuberculosis Prevention and Control Program.
Madam Chair.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Any discussion? Legislator Milne.
Yes, thank you, Madam Chair. Through the chair to the administration, do we have any idea truly as to why the funding for this program? I see it's down.
Through the chair, yes, we do have a very good idea. Across the state, as I mentioned, the numbers of TB cases were artificially suppressed during the pandemic. A number of other counties had greater suppression in their numbers than we did. And so when the state did their calculations for figuring out the new grant amount, first of all, their total amount available to pass out to the rest of us was less. And so they needed to figure out a way to distribute it equitably. And so in looking at all of the counties, they took average cases per year over 5 years, but because of the pandemic, they gave less weight to some of the previous years. They double weighted 2023. That hurt us because even though in the previous years our numbers weren't as suppressed as other counties were, because we actually did keep our team active. In 2023, we had 6 cases. That was an aberration. I couldn't even begin to tell you why that happened. But because it was a double-weighted year, we were impacted severely because of that math. They understand that it impacted us and a couple other counties similarly, which is why they did a 2-year grant, and then they're going to recalculate after the first 2 years of this grant.
Any further discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0390, acceptance of a grant from the New York State Governor's Traffic Safety Committee for the comprehensive toxicology testing in driving under the influence and driving under the influence of drugs program.
Madam Chair.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Any discussion? Yep, Legislator Cruz?
Through the chair, will the use of these funds change from past years in order to support the new community traffic safety team?
Through the chair, I'm sorry, could you repeat that, please?
Will the use of these funds change from past years in order to support the new community traffic safety team?
Through the chair, the answer seems to be no. So this particular grant is related to toxicology only. So this funding is used for us to offset the cost of testing, in our DUI cases. So that's really the sole purpose of the grant, this particular grant.
Thank you, Olivia.
Yeah, Legislator Smith.
Thank you, Madam Chairwoman. Through the chair, is there a growing number of driving under the influence and driving under the influence of drug cases in Monroe County and the Finger Lakes region?
Through the chair, that's an interesting question. I can't say that there is, because we've actually seen a decrease in cases that are submitted to us. That's why we requested, lower funding this year compared to the previous, and that's how it's been going. We always base our request on the most recent number of cases that we've been getting. But anecdotally, that has more to do, we think, with, again, that same issue of not being able to staff difficult shifts, things like that. So I think that's more of a question for law enforcement than for me. But in terms of what we're seeing, we have fewer submissions.
Further discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 24-0391, authorize a contract with the University of Rochester for support of the Forensic Pathology Fellowship Program at the Monroe County Office of the Medical Examiner.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? I'm going to declare my interest. All right, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. All right, we did this in under 3 hours. There being no other matters? Oh, okay, there being no other matters, the November 26, 2024 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held Tuesday, December 17th, 2024 at 5 p.m.